Hi, I'm Brian Utting. I'll be teaching a class on muscle-specific deep tissue techniques for the arms, legs, and shoulders in Austin on October 10th and 11th. We'll be doing work that's more precise than a lot of deep tissue work, and I wanted to show you something on the lower leg, on the posterior calf. On the posterior side of the calf, we have deep fascia wrapping around all of the muscles, the gastrocnemius, the soleus, and everything else. As you probably know, this material can shrink wrap around the structures and create a lot of difficulty in standing and walking and posture. There's a muscle or a vein that comes through here called the small saphenous vein that we need to be careful about because it can bruise easily. Then we have the gastrocnemius, which we will cover in the class. We'll cover some fascial techniques for this region, and then we'll go into the gastrocnemius and soleus, and then we'll go down to the deeper structures. Underneath the gastrocnemius and soleus and the fascia, we have three muscles which collectively are known as the deep calf flexors: tibialis posterior, flexor digitorum longus, and flexor hallucis longus, or Tom, Dick, and Harry for short. All of these muscles cross over the medial malleolus and are plantar flexors and inverters of the foot. More importantly, though, they help maintain the medial arch and proper relationships between all of the foot bones. What often happens is that they get overpowered by the peroneal muscles and other structures and start to break down, and the arch breaks down as well. We're going to, in the class, very specifically massage each one of them. What we need to be careful about, though, is that they are underneath the peroneal nerve, the tibial nerve, the peroneal artery, and a lot of lymph beds. So we can't just go in and shred everything. We have to be more surgical about working with these muscles. Normally it's difficult to get to the deep calf flexors because they're covered by the fascia and the gastrocnemius and the soleus. But since the gastrocnemius is also a flexor of the knee as well as a plantar flexor of the foot, if we bring the knee up into flexion, the gastroc relaxes and is taken out. Then, if we put our shoulder on the foot, so the foot is plantar flexed, that helps with softening both the gastroc and the soleus. Then we want to go to this middle seam here between the heads of the gastrocnemius and be very surgical about what we're doing, because remember, we have the small saphenous vein here and those nerves and arteries. Then I'm going to go through and just simply drop down to the interosseous membrane where the tibialis posterior lives, and you'll find abundant, on most people you'll find abundant trigger points and areas of tension. Andy, who has generously agreed to be the model for this, is a triathlete, and in my experience working with marathon runners and triathletes, they really appreciate and need this work. Tibialis posteriors takes an enormous beating when they are training and performing, but rarely gets stretched or addressed in bodywork sessions. So what I'm doing right now is just swimming through the gastroc and the soleus down to the tibialis posterior right on the interosseous membrane, and doing a kind of combination of trigger point and cross fiber and stretching movements on the muscle. Once I'm satisfied that I've gotten everything in the tibialis posterior, I can come over to the flexor hallucis longus, which is on the lower half or third of the lateral leg, and contact that muscle. This one is more sitting right on the surface of the bone and often gets glued to the soleus, so you'll feel this wad or lump right here that needs to be stretched out and softened up. When it's time to go for the flexor digitorum longus, our best window for that one is over here on the medial side of the soleus and gastrocnemius. I'll bring my fingers around like so. Have Andy wiggle her toes so I know where it is, and then once I've found it, do either a passive or active dorsiflexion, and then move to another place and continue to release this muscle. This one is very tricky because the greater saphenous vein, which is can be very fragile in a lot of people and is a common varicose vein, is sitting right on top of the muscle, as well as a number of nerves and artery and lymph beds. So what I want to do here is do as little movement as possible, or as little rubbing as possible, and more of a static contact, and get the motion out of moving the foot rather than causing any collateral damage to all those delicate structures. This is also an excellent position to go after the popliteus muscle, and we'll be covering that muscle in the program as well.